Hi, I'm Dr. Alvin. Today, we're going to talk about tonsillitis. So please stay tuned. And if you haven't subscribed yet to my channel, please do so and click that button. Before we discuss tonsillitis, let us first define what tonsils are. Tonsils are lymph nodes that functions as defense mechanism and help prevent our body from getting an infection. Let us now discuss the types of tonsils. Basically, there are 4 types of tonsils. I'm going to post it just beside me, alright, so that we can get through it one by one. So the first one are the pharyngeal tonsils, or the adenoids. They reside just behind your nose. The second type of tonsil are the 2 pieces or the 2 tubal tonsils. They're found just near the opening of the eustachian tube. The third one are the 2 palatine tonsils, which reside on both sides of the back of the throat. These palatine tonsils are the most common tonsils that we complain about whenever we go and visit our physician. The fourth type is the lingual tonsils. They're located at the back of your tongue. For this vlog, we're going to focus on the palatine tonsils. What are the signs and symptoms of tonsillitis? Of course, there's sore throat, inflammation of the tonsils, dysphagia, or difficulty to swallowing. In some instances, it's also experienced by persons suffering with tonsillitis, the painful swallowing. Fever, which is 37.8 degrees Celsius and higher. At the same time, in some instances, scratched or muffled voice. So these signs and symptoms are experienced by patients or by us suffering with tonsillitis. So how do we get infected with tonsillitis? What is the mode of transmission of tonsillitis? Well, basically the mode of transmission of tonsillitis, it is through direct or close contact with an infected person. It is also transmitted through contaminated droplets produced by coughing or sneezing. This transmission is to another person by both viral or bacterial infection. In some cases of tonsillitis, if this lasts for 2 to 3 days, commonly this is caused by a viral infection, because viral infection just goes out on its own, even without any medications taken. On the other hand, if it's more than 3 days, definitely this is a bacterial infection. And this is the time that you should go and visit your doctor or your physician for that matter. At the same time, the most common bacterial infection causing tonsillitis is the group A beta hemolytic streptococci, which is Streptococcal pyogenes. That's the most common bacteria causing this one. Alright? So now we have defined the tonsils. What are the causes of tonsillitis? Its mode of transmission, and also the signs and symptoms. Treatment, again, for tonsillitis depends on the signs and symptoms being presented by the patient. It's either the patient is having fever, so the fever should be treated as well. On the other hand, if the problem is brought about by bacterial infection, that's the time that you will be taking antibiotics. Okay? So, thank you very much. I hope you did learn something. God bless.